The majority of retinal detachments occur anterior to the equator, where the retina is hard to visualize without techniques such as scleral indentation. As a result of this, we need to have another indicator for retinal detachment, and this is what Schaeffer's sign or tobacco dust is. It is a release of blood cells or pigment clumps into the anterior vitreous that indicates that a rhegmatogenous retinal detachment has occurred. In fact, a positive Schaeffer's sign is assumed to indicate a retinal detachment unless proven otherwise. In order to conduct this technique, the first thing we do is to have a clear section of the cornea whilst having an angle between the observation and illumination system of about 15 degrees either side of the midline. Once we have this, and we have a clear section of the cornea, we push the slit lamp forward until we generate a clear section of the anterior part of the lens, as seen here, and then continue to push the slit lamp forward until the posterior part of the lens comes into focus, as we have now. What we are trying to do here is to focus on the posterior part of the lens and then move further in so that we are focused in the anterior vitreous, as shown here. Once we have this, if there are any pigment clumps in the anterior vitreous, they will become visible in the beam as brown or black specks within the beam. To improve the visibility of the pigment clumps, we need to increase the contrast, so we should switch off all of the ambient light whilst examining the anterior vitreous. Also, as the pigment clumps might have settled due to gravity, it's a good idea to agitate the vitreous to make them move around and pass across the pupil. We do this by simply asking the patient to look in different directions and then straight ahead, so as to cause the vitreous to shudder.